Hello viewers, I'm Dr. Himanish Roy, consultant pediatrician, Bhagirathi, Neotia, New Town. So today we are going to discuss a very important and recent topics that we are seeing that a lot of children are suffering from a heavy viral fever. So fever, what are the symptoms we are getting? The symptoms are very high fever, more than 100, 101, 102. Lot of children are coming. Mainly we are getting the children from age group of 6 months onwards, 6 months to 5 years, 10 years. Okay, and from newborn to 6 months is very less. We are getting cases, but the cases are very less. So come to the symptoms. So symptoms are mainly the gastroenteritis like features like vomiting, loose motion, high fever, cough and cold. This is very important. We are finding that fever is persisting for 3 to 5 days and the cough which can persist for 7 to 10 days also. And we are also seeing in some cases breathlessness and bluishness of the body, breathlessness in extreme cases. So parents are asking us that doctor whether this is a third wave of COVID. The answer is not very clear because we are doing test on some children and the maximum children are coming COVID negative. But rare cases we are also getting 1 or 2 children COVID positive, but it is very rare. So certainly we can say that it's not the third wave. So the next question comes, what are the causative agents which are responsible for this viral? So in some admissible children, we are doing the viral profile, and from that viral profile we are getting that the main causative agents are seasonal influenza or flu viruses, and in some cases we are getting RSV or respiratory syncytial virus. These are very common virus or which causes seasonal flu, but this year these are causing the pandemic fever in some children. Now, what are the danger signs? The most of the children are recovering from this fever, from the cough with time, but we have to see for the danger signs like breathlessness. If your child's respiration is more than normal, so it is a danger sign. Next, the face is becoming very blue, the tongue is becoming very blue, so it is a very dangerous sign. And the fever is not responding within 5 days, it is continuing for 5 days or more, high fever. So these 3 signs are very alarming signs. You have to consult your doctor as soon as possible. So the parents are telling us that doctor, should we do any test? Yes, we should do some test if the fever does not subside within 3 to 5 days. The first test we have to do RT-PCR COVID. Then we should do a viral panel if the child is admitted under our hospital. And next we can do the dengue, malaria, which can cause this seasonal infection always. So prevention is try to avoid the crowded places. That is the very important thing. Parents and the caregivers of the children should wear a mask. That is extremely important. You can make your child wear a mask as possible, but we, the adults, should wear a mask. That is important, and try to avoid the crowded places. These two are very important preventive part. Because these viruses are all airborne, it can transmit it from one person to another by droplet route. Now, what is the treatment protocol? So keep your baby well hydrated, give lot of fluids per mouth, that's very important. If the child is suffering from fever, we can give antipyretics like paracetamol, and you have to follow your pediatrician's advice because you have to see them. They will prescribe some medicines like anti-cough medicine. If required, they can give some antibiotics, but it should always be taken with the advice of your pediatrician. So lastly, I can say that don't panic. Certainly it is not the pandemic of third COVID wave. It is a seasonal flu, but in exaggerated form. Don't panic. You have to be very careful. Keep watchful. Thank you so much.